I'm going to talk about pulmonary embolism. Pulmonary embolism is blood clots in your lungs. Now, these blood clots don't originate in your lungs, they're coming from some other place. And 79% of the time, they're coming from a deep vein thrombosis in your legs, the veins of your legs. They can also come from the right side of your heart, like atrial fibrillation can throw blood clots. Also pelvic veins after childbirth or surgery, or also venous catheters or pacer wires can be a source of blood clots. Now these blood clots break off and they're called emboli, and they travel through your circulatory system and they get lodged in the small vessels of your lungs, and then they prevent blood flow and thus prevent perfusion. So you'll have symptoms such as shortness of breath, tachypnea, bloody sputum, cough, altered mental status, possibly fever, anxiety, or you'll have no symptoms at all. Sometimes people find out they have pulmonary embolism and they have no symptoms. It might be incidental to some other testing. So what is the testing for pulmonary embolism? There's blood test called D-dimer, and a D-dimer tests for the protein that results in the breakdown of fibrin. If you have a low D-dimer, then you don't have a pulmonary embolism. If you have a high D-dimer, you might have a pulmonary embolism. There's other things that can cause a high D-dimer, so that would require further testing. So your further testing might be a CT scan with contrast. That would show pulmonary embolism. If you can't tolerate contrast, a VQ scan can also show pulmonary embolism. So now that you've had your pulmonary embolism diagnosed, how are we going to treat it? So the gold standard treatment is anticoagulation therapy, and this might look something like IV heparin. This weight-based heparin would be dosed until your INR reaches a goal of 2.5. Then you would be bridged with low molecular weight heparin such as Lovenox, and you would go home on a warfarin or some other newer anticoagulant. Some people think that anticoagulation therapy is dissolving the blood clots, but really it's not. It's preventing more blood clots from forming, or the blood clots that you already have, preventing them from getting bigger. Your body's going to break down those blood clots eventually. You just don't want to exacerbate the problem with more blood clots or bigger blood clots and cause more problems. Some of the risk factors for developing blood clots are immobility, increased blood clotting potential from medications such as birth control pills, pregnancy and postpartum, and genetic predisposition. Also, damage to venous walls are risk factors, such as crushing injuries, surgery, and broken bones. Some of the nursing considerations for treating patients with that have pulmonary embolism is, you want to monitor vital signs. You want to monitor telemetry. You want to monitor labs such as the PT and INR. You want to provide oxygen if necessary. You want to elevate the head of bed to ease breathing. You want to monitor for complications from the anticoagulation therapy, such as bleeding. And then you want to provide education because they are going to be going home on anticoagulation therapy.